Welcome to Metabolic Health with Dr. Lindsay Ogle. Today, we are going to talk about an often overlooked diagnosis, but an extremely important diagnosis to review, and it's called atypical anorexia. And I have an expert here to talk about atypical anorexia. I have Isabelle, who is a registered dietitian. She is also the owner of Bamboo Nutrition in Columbia, Missouri, and Rochester, Minnesota. She specializes in eating disorders and um, her Bamboo Nutrition Clinic. It started off with just dietitians, but they actually expanded into an interdisciplinary clinic and included therapists. And with their dietitians and therapists, they approach patient care through a non-diet, weight-neutral approach to help improve behaviors and thinking around food and body image. So I couldn't think of anyone better to have here today to talk about atypical anorexia than Isabelle. So thank you for being here.
Absolutely. Thanks for having me on your channel. This is really fun and something I'm very passionate to talk about. So, looking forward to it. Let's dig in.
Absolutely. Well, before we talk about atypical anorexia, let's talk about emotional eating, which is extremely common. And I think we all do emotional eating at some point. So, can we define what emotional eating is?
So, I'm going to use my own definition because I know anybody can just Google this and find a definition that they're looking for. So, when I'm in particular working with clients, which I mostly work with individuals, like you alluded to, with eating disorders. However, we do find individuals who come to our office and clinic who are unsure, do I have an eating disorder? Is this something I need to be worried about? People often have a concrete image in their mind of what an eating disorder looks like. So when they don't fit that mold, they're confused. But they can definitely identify with this concept of emotional eating. And for some people, emotional eating might be when they're feeling emotional, when they feel sad, when they're having a rise in emotions that they can't control. And oftentimes, this might look for somebody, they're in their car and they want to go through a drive-through, or they are at home and they raid the pantry. So it can sometimes feel like as an emotional eater, I eat to excess, I eat to the point of overfullness. It's uncomfortable. But what sometimes we don't think about is emotional eating can also be different emotions. It can be for numbness. It can be depressive episodes where it can be more related to anger or just long-term episodes of anxiety. So it's not necessarily an extreme emotion, but it can also be used for numbing. It could also sometimes look like not eating. So even though in the term emotional eating, you're assuming you're doing the verb eating, but sometimes you're not. Sometimes you're emotional and you're avoiding food. So that's how I would best describe the definition of emotional eating is it can look different for everybody, but also to just kind of break what the concrete idea some people have in their heads of what that looks like. It's not always black and white.
Yeah, thank you for going over that. And I love how you brought up it's not always those extreme emotions, because I think that that's, like you said, most commonly thought about are those extreme emotions. And think it's really important to bring up the numbing aspect because I do see that quite a bit in my practice. And just with talking with people about emotional eating, I think that that's extremely common. And it can get into a point, and I'm sure you see this in your practice as well, that it just gets into a habit that we don't even realize that we are doing it, are using food for numbing. And I think that that's why your clinic is so wonderful because not only do you have the dietitian perspective, but you're working very closely with the therapist to help bring out those emotions that have been numb for so long when somebody isn't even, realizing that they're doing those behaviors.
Absolutely. I think most of the time you're unaware of it or it's normalized in society of, yeah, you're upset. Of course you're going to go get a milkshake, whatever, or of course you're going to eat a bag of chips. Or it's common to see on commercials, especially commercials that are selling medication for depression. A lot of times you see lots of food around, you see garbage piling up. And so it's just kind of normalized that if I have this condition, this is what I do. So you immediately go to treat the condition, but you're not thinking about the symptoms too, which is complicated because food, I tell my clients, you do food, you eat food, you make choices about food up to 6+ times a day on average. So if you're going to ignore the symptom of emotional eating or how you're eating your food, the behaviors around that, this is a problem that it's going to create negative habits in which even if you did treat the depression or whatever the condition is you're struggling with, the emotional piece, you could still have these lingering negative behaviors with food that could eventually turn into an eating disorder or at least entrap you in this dieting spiral where your confidence with food, your confidence with your body image, your confidence eating around other people can be really poor.
Yeah, and that brings us to the next question. What is the difference between somebody who is emotionally eating or maybe following like a strict diet versus a true like definition of an eating disorder? How do you go about deciphering between those?
There are sometimes online quizzes. I think as a provider, as a treatment professional, I am probably going to treat you the exact same, whether you come to me with a diagnosis or without, which side note, dietitians cannot diagnose. So if you go see a dietitian hoping that they can tell you, specifically, do I have an eating disorder? If so, what kind do I have? What is my diagnosis? Well, we can't even do that first off. So we don't even try. But does it change my treatment? Probably not, because even if I'm not going to treat you like somebody with anorexia nervosa who's maybe even needing a higher level of care, maybe you're not that extreme on an eating disorder where I'm really worried about your medical stability. I could still use a lot of the same tools that I use with depending on what your behaviors are. There's binge eating disorder, there's anorexia, there's bulimia, there's um, some things like in between there where it would fall under this diagnosis of other specified feeding and eating disorders. So there's all these treatment tools in my toolbox that I could use for you, no matter if it's a real diagnosis or not. The bigger thing is proving it to yourself because we have clients who I would say are definitely ambivalent to treatment. And it could also be because they're in denial of the problems that they themselves are encountering. So it's more proving it to you than myself.
Yeah, well, that's wonderful, and I love that approach because, like you said, even if you don't have a clear diagnosis, or you haven't been able to find the right physician or nurse practitioner or PA or the somebody who can make that diagnosis, you as a dietitian and your other dietitians and your therapist can still provide excellent care. And I think that that's really important, especially because there are not a lot of eating disorder specialists in the on the medical side to make those diagnoses. And our hope is that primary care doctors and obesity medicine doctors are trained and qualified to make those diagnoses, and most are, but not everybody has had that specific training. And I know, during my residency in family medicine, I chose to do an elective with at an eating disorder center, and so I had that additional training. But that was something that I sought out myself. It wasn't really built in into our curriculum. So it's not something that everyone is comfortable with. So, like you said, you might not, present to the dietitian with that diagnosis, but that's wonderful that you're still able to, help all those patients, even if they don't have that clear diagnosis when they come to you.
Yeah, and I appreciate you saying how eating disorder training is really something that the provider has to seek out.
Mhm.
And it doesn't make you a better provider or a worse provider if you have that experience. It just helps maybe give you a different set of tools in your toolbox that you can help clients with. That's how I would, yeah, describe that. But yeah, absolutely.
Yeah, and that brings us ultimately to atypical anorexia because this is something that is often overlooked. So let's just start with what is the definition of atypical anorexia?
So again, my definition would be if I were to describe this to somebody, it's someone who's in a larger body. So when you think of an eating disorder, I feel like most people are thinking of anorexia nervosa. They think of someone who is skin and bones, who looks very, very sick. It's obvious they're not eating, they're restrictive, um, and it's the medically unstable person that they're thinking of. It's clear that there's something going on with food. But what we don't think about is someone in a larger body who's maybe doing the exact same thing and who's also medically unstable. Yeah. And one of my least favorite things, so trigger warning to anybody who's in a larger body and maybe has been given this advice, is the medical professional from what is it, 600 Pound Life, I think, like
Mm.
specific name of the show. And he tells people in larger bodies, I don't care if you're hungry, you don't need to eat. You can go days without eating because of your body. And that drives me crazy because I feel like those words in itself are reasons why people in larger bodies who are restrictive don't seek care because they think my body can handle it. I've heard that messaging before. This is what other people believe about my body is that I should be able to go days without eating because of my size and my fat stores on my body. And that cannot be further from the truth. I will say, to that man's credit, there is medical monitoring going on for a lot of those patients still. So if they're going days without eating, I hope that they're still being medically monitored, but for the person, an outpatient who is going days without eating and they're doing this secretively and they're not sharing that with anybody, they're not being medically monitored. And your body is still going to react to restriction the same way someone in a normal classic form of anorexia nervosa's body is going to respond to that. So that is my long about definition of atypical anorexia is you still have the same symptoms. You are just at a higher body size point than somebody with typical or classic anorexia nervosa.
Yeah, and that's the same definition that I have. And I know that there is a lot of discussion about whether the term atypical anorexia is even an appropriate definition because it is still true anorexia. There's we just have the atypical because, like you said, it's not what society or classically we expect somebody to look like. But it's the same disease process. You still are excessively restricting to the point where it's causing physiologic changes in your body that can cause harm and that truly do need medical attention and supervision. Um, so there's discussion about that definition and what it should be, I guess, termed, or if it should even have its own terminology. But I do think that having some sort of, identifier like atypical, or if it, has a different name later on, is helpful just to remind us to look out for this because it is, again, so often overlooked. In the medical world, obesity medicine is becoming such a more popular field. And I do know as someone who's gone through that training that we get educated on this topic, which I think is really important. So we're not missing that. But other providers who maybe are not board certified in obesity medicine are not getting this training. And this may be something that more commonly gets overlooked. If somebody has this diagnosis or suspects that they may have this diagnosis, what would your recommendation be for moving forward with treatment?
Yes, so good question. So often as a dietitian, I get asked, who do I need to see first? Is that a therapist or a dietitian? And my answer to somebody who's unsure if they have this diagnosis, what to do, is to just start talking to somebody, some professional ideally, who has understanding in this space. I wouldn't just go see a therapist who has no knowledge on atypical anorexia. I wouldn't even speak to a medical provider who has no understanding of eating disorders because that's what you're trying to understand about yourself. So go to somebody who can really help ask you more questions, inspire deeper thoughts to identify maybe this isn't a full-blown definition or you meet criteria for this diagnosis, but there's clearly something going on here, and it's wonderful that you are concerned and wanting to talk about it and want to address it because it doesn't need to be a diagnosis for it to be a problem. And I think we need to make sure that everybody understands that when it comes to eating behaviors is it is still a problem, even if it doesn't meet diagnosable criteria. There's so much talk about throwing out diagnoses here and there. I have ADHD, I have ADD, I have depression, I have anxiety, I have, all these things. And just to name the biggest ones that come to my mind. And we just, I'm more worried about what are your behaviors? What are your symptoms? How is this impacting your life? Is this a disturbing thing for you? Is this a big problem in your relationships and your social relationships, or is this just something that you think about here and there and but it's not a big deal? So I would first try to just seek somebody to go to who can help ask you those questions and inspire deeper thought. And then you might end up seeing both a therapist and a dietitian because oftentimes this is kind of a two-sided coin where you have the mental health problems associated with the eating behaviors, but you also need a dietitian, someone who's knowledgeable about nutrition and your entire body, how that's affecting you, whether you're eating or not eating, the medical part of that. So you might be referred to another specialist, and that should not provoke fear or concern on your part. It's just considering that you're getting a full hug. The therapist on one side, the dietitian on the other side, we're just giving you a complete hug and treating you as a whole person and treating both symptoms of the coin.
Yeah, I love that. And I love that you touch on, the not always the exact diagnosis. It doesn't, I guess, matter too much. And again, to highlight these diagnoses and definitions are constantly evolving. I mean, I've haven't been practicing, I've only been practicing for a few years, like outside of residency and medical school, and I've already seen some definitions of these diagnoses change. And so we're always redefining and refining our, diagnostic criteria. So those will evolve over time, but the treatment principles remain the same. And so I think that that's really important to highlight. And I always emphasize the importance of building, yeah, a team around you that's going to support you, and that'll look different from person to person. But I think that that's so helpful to just have multiple people that you can reach out to and support you on a journey, and it's something that is going to be on the span of months and years and sometimes decades. It's not something that is immediately resolved with one appointment, and so having multiple people can just help ensure that you succeed. So I appreciate that. And I wonder if you talked about finding, like, it sounds like safe spaces and providers. Do you have any tips for somebody who is looking for maybe a eating disorder specialist? Is there like a website they can go to where they're listed, or are there certain things that someone should maybe watch out for on websites, like particularly wording that is, included on websites or um, flyers or social media for somebody who is looking for help in this area?
So here is my quick and sure to work answer for anybody is find a treatment center, an eating disorder treatment center. Those are much easier to find than individual providers.
Mm,
So I would find the treatment center and then I would contact them and say, who are your outpatient providers that you refer to?
mm,
Because they take the time to do the networking. They take the time to find the safest people, the smartest, the most dedicated eating disorder professionals in the community to refer to. So I could tell you, go to this website, look for this wording, on this person's profile in Psychology Today, look for this wording on the website for the dietitians. But that gets so complicated. And I am so exhausted by seeing people say that they work with eating disorders
mm,
and I don't know about them. They just pop up. They think that it's okay to just put that on their resume of yes, I do eating disorder work, but they have no training. They don't know how to work on a team. They don't know the medical science behind eating disorders and the fatality statistics behind it, and how serious and grave it is.
Mhm.
So I'm done with telling people that's how to do things. Now I say go to the treatment centers, contact them and say, I want a list of your outpatient providers.
Mhm.
Because some of these people at treatment centers oftentimes have their own private practice too. So they're really good because they have seen all levels of care, they've been well trained, or they contract with the treatment center, or again, it's just the treatment center itself has done a very extensive job of finding the right providers in the area. So I know without a doubt, if anyone in Missouri were to go to a treatment center and say, I am located in this area, can you please help me find an outpatient dietitian or therapist? I know that I'm on that list because I care. I've networked with all of them because this is my niche. But
Mhm.
the other person down the street from me who says that they do eating disorders, this isn't true, but who says that they do eating disorders, but really they don't, I know that they likely have not networked with that treatment center because they don't actually work with eating disorders. They just say that they do. So, so that's how I would go about that.
Yeah, that's awesome. And that takes a lot of pressure off of the, patient or client who is looking for help because, like you said, that eating disorder center has already done the vetting for them, and you can just get that list and, find who takes your insurance or who's closest or whatever you're looking for, and can find a trusted provider that way. So that's really great advice. Thank you for sharing that. Uh,
Yes, the insurance piece too. I didn't even think about that, but they have all that written down. So absolutely.
Yeah, that's amazing because it can be very overwhelming to find somebody. And if somebody is trying to find you or your practice, how would they go about doing that?
So we're located in Missouri. We are hoping to branch out to a few other states because we have part of our team located in California. I'm in Minnesota currently. So we're trying to branch out, but right now, where majority of us are licensed is in Missouri. So if you are not a Missouri client, you can still reach out to me and I can also do my best. You can treat me like a treatment center and I can do my best to find you the right resources. But for anyone in Missouri who's seeking care for an eating disorder, our practice is called Bamboo Nutrition. And we do have therapists, so it's Bamboo Nutrition and Therapy, but the website is bamboonutritionrd.com. And people reach out over the phone, over Google, they email us, they complete the form on our website. Any avenue, just do whatever is easiest. And I also tell people just because you submit that contact form or you reach out one time does not mean you are signing up for 9 months of treatment. You are just starting the process to get to know about it. And that's fine if you back out or if it's not the right time for you.
Yeah, thank you so much. And you have a wonderful staff in your clinic, and I always include your link to my new patient so they know about your resources and they can sign up whenever they're ready to take that step forward. So thank you for all that you do, and thank you for taking the time with me to talk about emotional eating and atypical anorexia. It's such an important topic. Do you have any, last minute thoughts or anything that you'd like to share before we end this conversation?
I just want to thank you too. I mean, you always get to have the final say on these and praise people, but you deserve praise too. You're a wonderful provider, and the fact that you have the knowledge and understanding on both sides, what it's like to be metabolically healthy and then working with people in larger bodies, but also having the understanding of eating disorders and holding space for both of those things is so, so tricky. And it takes a very capable and kind and empathetic provider to be able to hold both of those things at a time. So I want to praise you for that. And thank you for inviting me to come here and speak. Sorry for baby babbling in the background. If anyone's listening to this and wondering what that noise is, that is a 6 months old baby who is loud. But thank you so much for working through that with me. I appreciate it.
Yeah, anytime. And hopefully later on we can get together again and talk about another topic.
I love that. Thank you.